Welcome back. More than 700 people from 3 local government areas of Oyo State, southwest Nigeria, have received free health services under the Rapid Response Initiative of the federal government. The Federal Ministry of Health kicked off the initiative at the University College Hospital, Ibadan, the state capital. The Chief Medical Director at the facility, Professor Temitope Alonge, says the initiative is aimed at providing access to quality health care services to poor people in their local communities.
The first phase of the initiative is planned for the 11 local government areas in Ibadan, the Oyo State capital. In Akinyele and 2 other local government areas, the Chief Medical Director, University College Hospital, Professor Temitope Alonge, the Chairman, NMA in Oyo State, Dr. Babatunde Latunji, 20 doctors from pediatric, ophthalmic and general surgery departments, as well as about 30 relevant health workers have been drafted to attend to as many patients as possible. In Monia Akinyele local government area, patients are being assessed and treated for various ailments ranging from hypertension, diabetes, hernia, eye defects to other complex health issues. Professor Alonge reveals that more than 300 people have been given referrals to UCH, out of which over 60 will be operated on free of charge. The initiative, he says, is to give unrestricted access to rural people who ordinarily cannot afford quality health care.
One thing we've been seeing and which is interesting is that we have a lot of people whose blood pressures are ranging from 200 to 120, 220, and that is one of the things we're worried about. But otherwise, and there are loads, almost about 1/3 of them actually have problems with their eyes, cataract and corneal opacities. Again, all of those ones will have to be attended to. We have a retired matron, a public health nurse who is from Monia, and she took it upon herself to go to the mosques and churches to do the enlightenment. This is a good lesson for us, so we will do the same, looking for people in that particular locality and use them as focal persons to help us spread the news.
The NMA chairman in the state, Dr. Babatunde Latunji, identifies non-disclosure on the part of patients as a major cause of bad health.
Because of poverty or cost and affordability, they keep it to themselves and they can't actually seek for the health intervention that can address their issue. Vis-a-vis, you have cases like glaucoma, you can have cataract, you can have hernia, you can have cleft palate, even BVF. You can have other obstetric and gynecological cases in this kind of environment. So with this kind of intervention, we are hopeful that perhaps people will be able to access free health services and their health condition will be a little bit ameliorated.
In the meantime, cases that require surgery are billed to commence within this week before the team moves to the remaining 8 local government areas in Ibadan and the rest of the state.
Well, the police command in neighboring Ogun State has paraded a 40-year-old man, a serial burglar, suspected to be responsible for many robbery operations in Abeokuta, the state capital. Items found in his care include many television sets, generators, mobile phones and other items suspected to have been stolen. Parading the suspect, the police command public relations officer Mr. Abimbola Oyeyemi said the suspect was arrested after a tip-off and information from members of the community.
This man, whom we later identify as one Tosin Faleye, he has been around this place for quite some time now. He is believed to be a destitute. He always begs from one place to the other, begging for alms. But the police believe that this man is not actually a destitute, that is having an ulterior motive. That is why surveillance was mounted around him. We have been trying to investigate him for quite some time now. And based on our intelligence gathering, we move into the place where he's living. And on getting there, we conducted a search. And what was recovered in his house is all these items you see. That is to tell you that this man actually has something hidden. Because somebody who is believed to be a destitute, who is believed to be a beggar, how come he's in possession of about 20 television sets, a bundle of iron roofing sheet, about 11 GSM phones, all functioning, and about 5 generators? How does he come about all these things? That is why we are still going deep into the investigation. We want to find out what actually is the work of this man, what actually is his motive.
Well, that's it on News Across Nigeria. Thank you so much for watching. I'm Joker Rogers. Bye for now.